Welcome, everyone, to another episode of the Parkinson's Policy Podcast, where we advocate together to raise awareness and advance meaningful policy for the Parkinson's community. Literally from Washington, D.C., at the U.S. Capitol and beyond, we bring together senators, representatives, researchers, and advocates to amplify the voices of people living with Parkinson's disease and this entire community. My name is Dr. George Ackerman, Sharon's son and founder of TogetherForSharon.com. Joined by me, my amazing co-host, Margaret Preston, president of Power Over Parkinson's, and we want to welcome everyone back for another really critical, important episode at this time in our community.
Thank you so much, George. I have the honor of introducing our two next guests from PMD Alliance. We have Dr. Kelly Papesh. She's a nurse practitioner, and she's dedicated her career to expanding access to specialized care for individuals with Parkinson's disease and related movement disorders. Dr. Papesh has also played a pivotal role in advocacy, education, and clinical innovation. As clinical director at the PMD Alliance, she's developed CME-accredited educational programs, led advisory committees, and strengthened the professional network of healthcare providers focused on movement disorders. She continues to drive awareness, policy change, and improve care delivery models for individuals with PD. She's also co-founded Neuromotion Telehealth, as well as the Association of Movement Disorder Advanced Practice Providers, where her leadership ensures that more advanced practice providers, or APPs, are equipped to deliver high-quality, evidence-based care to underserved populations. So I'd like to welcome Dr. Papesh, and I'd like to move on to our next guest, Rebecca Korduner. After graduating from Gordon College, she launched her career helping a myriad of nonprofit organizations research and implement IT solutions. Never one to stagnate, Rebecca grew into numerous roles, including Salesforce administrator, web developer, IT manager, grant writer, program facilitator, and associate director. All of this experience honed her ability to think at a more global level, as well as a more granular level, moving her into her role at PMD Alliance as the Chief Strategy Officer. It's a great blend of innovation, technology, and program delivery, which really allows PMD Alliance to grow their online community of individuals all over the world. So I want to welcome you both to our show and sharing your time with us today.
Thanks for having us.
Yeah, thank you for having us.
Mm-hmm.
Well, it shows one where we disclose our interests, conflicts, and our bias. And I want to just tell everyone how really I admire both of you, not just PMD Alliance, but the two of you have always been there for me personally from the first day to end of days until we find a cure. But I just grateful to be able to discuss policy together with the four of us. So as we start, we always like our audience, at least if they're not aware of the work you're all doing, maybe you could touch on, what got you into the world of awareness, Parkinson's, and specifically working with such an incredible, again, in my view, one of the very leading ones, PMD Alliance out there today.
Mm-hmm. Kelly, do you want to answer that first?
Sure. Yeah, I guess I can speak to my path. It came from multiple directions, what led me into Parkinson's advocacy. As a nurse practitioner, I have watched patients navigate this system that was, simply put, not designed for the complexity of Parkinson's disease. And people are waiting months to see specialists. They're leaving appointments without clear care plans. There's caregiver burden. There's people in the background that are quietly burning out, whether that's clinicians, care partners, and even patients themselves. So this frustration, I think, really pushed me into co-founding Neuromotion Telehealth, which, geographically, we don't want to have access being an issue. And so I don't believe that geography or access should be determined by the quality of care. And then it became deeply personal for me when my father-in-law was diagnosed with Parkinson's disease. And so firsthand, not just being a clinician, but also now being family, seeing this experience from a different perspective. And both of those two things really led me into my work with AMDAP and of course with PMD Alliance as a clinical director.
And I want to thank you and the whole family. I had the honor to meet them in DC, and these moments are great, of course, but being there live and meeting, your family, and of course Rebecca, and also fighting for Margaret's father is why I'm still at the table and trying to push this 24/7. But it's really, I felt, life-changing being able to meet the family. So thank you.
Thanks, George. Same. That was a highlight for sure.
and how do I go after Kelly? I was saying, Rebecca, why didn't you go first? Because Kelly, as anybody who knows Kelly knows how amazing she is, and I will take every opportunity to say that. So as you read in my bio, I've worked in nonprofits for a long time. My grandmother had Lewy body dementia. I thought it was Alzheimer's. I was young. I just knew about her hallucinations and delusions. And she lived alone and was probably my favorite human. She was a connector. She was somebody, even after she passed away, my brother in his eulogy was talking about, look at how all of us, where we aren't typically together, like she brought us all together. And she did do that. And I've always, been passionate about trying to help. I've always wanted my life to have some sort of purpose. It's never been something that I wanted to, I don't know, I wouldn't be happy just like going to a 9-to-5 job and just kind of clocking in, clocking out. I did AmeriCorps right out of college, and just that kind of continued to perpetuate me in this world. And actually happened upon PMD Alliance about 7-8 years ago, was looking for a remote job before remote work was a thing, and ended up getting a position with PMD Alliance. And I remember just thinking, like, do I want to go into healthcare? But the more I learned about Parkinson's and got to meet the community, the more I fell in love with the community, and obviously have my own connections. Since then, my aunt has a movement disorder. One of my cousins passed away from Parkinson's. It's like you don't really think you know someone until all of a sudden you start talking about it. And honestly, my time at PMD Alliance has, I think, even professionally, but in terms of the work I do with the community, has really grown to I've never been at a place where I felt like I could actually make a change and actually held that power to actually see a problem and say, how could we approach that? And then to equally get to work with people like Kelly and like the rest of our team. Honestly, Kelly is someone, which I am going to talk about Kelly, sorry, but she is honestly one of the most innovative, I don't think Kelly's ever heard no for an answer. And actually when Kelly joined PMD Alliance, I remember, because she reached out to us, she was just like, I'm going to do it. I'm going to, whatever. And I still remember her saying, wouldn't it be so cool if we would have an association one day for APPs? And literally, I thought it would be like 10 years maybe. No, Kelly was like, okay, 1 year from now, let's go. Let's make it happen. And she just, as you can see, even with neuromotion and other things. So getting to be able to work with people and meet people in the community and meet some of the amazing individuals and doctors and other organizations and people who run those and why they run them. That has been sort of my entrance into this world. It's weird because I never thought you usually after 5 years, you're like, okay, next. But for me, it's just I can't imagine myself not working in this community at this point.
Thanks, and we're lucky to have you, and again, have you both here today. Before I send the show to Margaret, I wanted to get to the real areas. The show is very different, unique. I don't think, in my view, there isn't one in the world like it. I'm surprised, and I think it's just because the times are changing. Policy is a huge issue. We were all in DC together. I was wondering what policy changes or public policy changes you believe would really have the greatest and most immediate impact on improving access to care, as Kelly was mentioning, and also support services for people living with PD and their families today.
Well, I think we can break this one up, Rebecca, but I think as far as public policy and immediate impact, so this is maybe selfish in the way that I, as a clinician, want to help deliver access, but I think telehealth permanence would be really vital. As we know, during COVID, a lot of the clinics, especially where I was at the Cleveland Clinic, we went to telemedicine. And I think we learned very quickly that good quality care can be delivered via telehealth in Parkinson's and movement disorders. There are a few things that you can't do. You can't touch somebody, you can't feel rigidity, but you can do all of the other things. And it's better to get access to somebody versus not having that. And so I think one of the biggest challenges we face, most clinics have maintained telemedicine in some capacity. And of course, I own a telemedicine only practice. So I think that having that really is going to be important. So I would hope that there's some telehealth legislation that is passed in that. I think that there's also the specialist movement disorder specialist investment that needs to be taking place. I see this from the physician and the advanced practice provider side. We don't have enough movement disorder specialists, and we don't have enough to care for the growing amount of people living with Parkinson's disease. Loan forgiveness, training incentives, scope of practice expansion or understanding of APP's role, that would all extend the reach of the existing specialists significantly. I think that those are two priorities for me that I would love to see.
And when you asked that question, George, I'm like, do we have 2 hours to talk?
Yeah,
Because it's a big question. So I'll just answer with the first one that came to mind. And honestly, it has to do with just the owner. And we see this being talked about even in government right now, but the whole challenge with insurance, it's, with so many companies owning the insurance companies, owning the pharmacy benefit managers, so the PBMs, owning the pharmacies, owning the healthcare systems, like no matter what, it's all about that healthcare as a business. And that is what, there's no transparency, and hard for providers to provide transparency because what they have to charge and how they charge, it's not something that they necessarily want to do. It's being dictated if they're taking insurance, and then what people don't pay for and what they do pay for. And that's also impacts, things like Medicare and all of those things. They impact even, if people can pay for fellowships and, getting more. I mean, it's all interwoven and interconnected. And it's, I think that would be at least the very first thing that we could potentially, like I said, there's been a lot of conversations even in Congress. They've had a lot of the big companies this year, where they've been chatting with them. But I think across the board, all of us need and want and should have access to quality and affordable healthcare. So that would be in my mind, it starts when healthcare becomes a business, and that's where, and then that's really dictated by a lot of times the payers and sometimes the health systems.
And that's why I think it's so important for the show, because not just because it's our show, but we went all to DC with specific objectives. We were limited on time, talked about 3 to 4 issues, but the issues we're talking about now aren't at the forefront. And I hope everyone listening will reach out to their representatives throughout the country and bring up literally what our amazing guests today are talking about, because they also deserve the time and the address from our representatives, or we need new representatives. So anyway, back to Margaret.
Yeah, I can't agree with you more, George. I think, while DC had some great asks, I think we cannot forget about access to care, which dovetails me into my next question and the importance of access to care. We know Parkinson's has no bounds. It touches anybody at any age, any geographical location. So I wanted to ask, how does PMD Alliance really ensure or work to ensure advocacy efforts reflect this diverse patient experience across race, geography, diagnosis among movement disorders?
So I'll start with this one, Kelly, and feel free to jump in. But when it comes to, so access is a big topic, right? So we did a survey at the end of last year that we want to go deeper with about access to care, about people's experience getting diagnosed. And we know that some people get diagnosed very quickly, and some people it takes several years, especially if you're younger, or if you're a woman. If you don't fit this traditional model, we hear it all the time. We know that this is truth. So we had some data around that. But then in addition, it comes down to even, especially in some rural communities, if you think about all of the different academic centers and where they're located, majority of them are located in some of the bigger cities. And if you don't have access or you aren't nearby, it can be really hard to, and even if you are, you might be waiting 2 or 3 years to get in. Sometimes it's shorter depending on, again, where you're at and what access you do have. So for us, we recognize it's not going to be something we're going to be able to flip the switch on overnight. But we actually, so I had sort of mentioned this earlier, but, initially when Kelly started working with us, we did launch AMDAP, which is the Association of Movement Disorder APPs. And Kelly, I want you to talk about some of the things you guys are doing, because I agree with everything you said about APPs, nurse practitioners, and physician associates, and how important they are, and team, just the team care. And I think a lot of physicians that I talk to now talk about how APPs are going to help some of that access. And so to then dovetail on some of that, one of the things Kelly and I have been working on is how do we engage the next generation of neurologists? So we launched a mentorship program for movement disorder fellows and the senior residents. So folks, they have to know they're going to go into movement, and we match them with a movement disorder specialist. And usually around something that they're interested in. And it's all professional development. It's not clinical, but it's an opportunity to get them out of their general institutions and all of that, and have plans and are already taking steps to how do we continue to start engaging some of the, so without getting, like I said, I could talk to you for like 2 hours about this. Without getting too technical, the neurology residents, that first year is always internal medicine. So they're not getting any neurology, really anything. They're just in internal medicine. That first year, so they call it their PGY2 year, so post-grad year 2. That's when they start their neurology residency, and they start doing some rotations, and they have to decide their fellowship by about the 4th year. But movement, which maybe gets in that whole time, maybe gets like 3 half days in most places, not all places. There are some institutions that are wonderful, but they, so if you get 3 half days on movement, and now movement isn't just Parkinson's, right? It's all of the atypicals, MSA, PSP, Huntington's, Lewy body dementia. I mean, you can go on, right? And then, of course, Parkinson's, but you're only getting 3 half days. And so if you think about those folks who go in as general neurologists, and if they do get more than 3, if they do, even with the 3 half days, they get that in their 4th year. So they're not even getting it prior to choosing if they're going to go into fellowship or not. So like by the time they even get there, so now we don't have people who are going into movement. So for us, the way that we're trying to address that is we are trying to invest in the education and engagement of the, post-grad year, the PGY2s and 3s, that even if they don't go into movement, that they are still getting educated. And that's not happening right now. There's not really a lot of opportunities. They don't know to even look for those opportunities. So that is something that PMD Alliance is currently working on, that we hope and believe that over the next several years will start to increase knowledge over time of people either going into movement, so more movement disorder specialists, or for those who just decide to be gen neuros, or say they go into stroke or headache or migraine or something like that, they will then they'll have a community of movement disorder specialists who they can get information from. And then number 2, that they can, and also opportunities to get additional education. So it's kind of a 2-pronged solution, but one of our major strategic priorities.
Yeah, I mean, I'll just add, like, the Campfire program is absolutely phenomenal, and
that's our mentorship program. I didn't call it Campfire, but I appreciate you calling it Campfire.
The mentorship program, and it is, expanding outreach. But this question about like ensuring that we are reflecting diverse experiences at PMD Alliance, I hold this question, like I hold myself accountable to this question, not just organizationally, which we do, but the Parkinson's community. It's not monolithic. It's early onset Parkinson's raises different workplace, insurance, family concerns than someone who's diagnosed at 75, for example. Mm-hmm. Someone in rural Alaska has different barriers of access than someone in LA. Mm-hmm. And we know from research that the Black and Latino communities are underdiagnosed, underrepresented in clinical trials, which means that the evidence base that we're actually using in clinic is really itself incomplete, right? So it's not even fair. And at PMD Alliance, we care a lot about being intentional. Mm-hmm. And that means building community partnerships before we ask the communities to show up for us. We train advocates who reflect the patients that we serve. And we design programs that account for language and literacy and trust barriers. And we have programs like Spanish programs and webinars and even live programs. And as a nurse practitioner, as a clinical director at PMD Alliance, we see how quickly a one-size-fits-all model in care fails so many people. And I think the same is true for advocacy. You know, we have to listen first. What is our community telling us? We have to build trust. We have to lead together. And I think that's the only way we can do that. And I think PMD is very good at doing that.
And just to add to that, and I'm sure this will go into, I know because we talked about some of the questions earlier, and part of that is about that collaboration. You know, we all are, there's so many people who are suffering, and I don't use that word lightly, and there is so much need that we have to work together. We can't accomplish this on our own. And that includes some of the, you know, associations and community groups. And so that's, PMD Alliance was built that way. We were built to be, you know, really human-centric, and how can we invest in communities without claiming communities or what have you, but just how do we help empower and give people the resources that they need to help build their own communities. And so we do that in a number of ways, like Kelly shared as well.
Yeah, no, I appreciate everything you guys said, especially Kelly. What stuck out to me was establishing the trust. Because I think without that, obviously, we cannot serve these underserved communities because there is a lack of trust, because there's a lot of avenues and resources catered to the 75-year-old white male who has Parkinson's. So you guys are certainly starting from the ground up in terms of establishing the trust in the healthcare system that hasn't already been there. So I appreciate that.
I feel like what do we know if we don't ask, and if we're not listening? We can't just go in and think that we know what a community needs. And I learned the hard way with this telemedicine practice. You know, we launched in Wyoming because there's no movement disorder physicians there, and we don't have one patient in Wyoming.
Yeah,
and it's because they don't have the trust. What's a nurse practitioner? What's telemedicine?
Yeah,
you'd rather see your physician that has also seen every family member. Like, it's very interesting, but we went in so naively. I think the same goes for advocacy for all of this.
Yeah, I think we all learn you can't just bulldoze your way through advocacy and representation. So you guys are doing it the right way at the foundational level.
And like Kelly said, you bring in that voice, right? So you don't just take something that you wrote in English and then you translate it into another language. It's number one, probably not going to translate well, but number two, like, you have to understand the different cultures and actually take the time, and it takes time to learn and to understand it, and not just, you know, make it a checkbox of, oh, look, we're doing this thing for diversity. Like, no, like, actually, like Kelly said, taking that time and listening to them and building trust, I guess, is, you know, I think we talk a lot about being amplifiers. Like, we're more like, we see ourselves as, you know, incubators and amplifiers. You know, we are there to amplify the voice of the community, not to act as the voice of the community.
Well, the show is also a call to action. My other show and other shows like Margaret's are, you know, more about stories. This one, I hope that everyone listening will not just share it, but support both of you and also do something, because that's what the show is really, I feel, built for. We have to have everyone out there, and that leads to the next area. Is just curious, you know, why do you think policy is such important in the community today? And even more importantly than that, how can everyone out there listening, the advocates, caregivers, local communities work alongside with PMD Alliance to help drive stronger Parkinson's disease awareness and legislative action like we're talking about at also both state and federal, not just, of course, federal levels?
One thing that I can tell you from being on the Hill, the last two policy forums, the stories are truly like the currency of policy change. And so without patient voice, clinician voice, advocate, care partner voice, policy can't be pushed forward. And those stories matter. Showing up matters. Doesn't matter if you think that your story is small or minute in this huge, large push that we're doing. Every patient voice, every care partner voice, every clinician voice, every advocate, every foundation and organization, those are what push the needle and move things forward. It is so important that we use our voice, that we show up. It is the most powerful thing that we can do.
Thanks.
I think I would just add, you know, one of the things that I learned, and I've heard this from some folks in the community, is that, so number one, it is okay if you're somebody who wants to do advocacy work. supporting, raising up the voice of people who are doing that, like that's great. You know what I mean? I've learned that your whoever is, in your district, whether they're at the federal level, the state level, a lot of them do have someone who watches social media. So when you're tagging them, they are seeing things, even if they're not necessarily responding. Also, working local is really important. We forget that a lot when we focus so much. And yes, federal is very important. And I think we're going to see, and we see this even Texas had they like funded like several $1 million, $1 billion. I don't actually know the actual amount towards Parkinson's and dementia research. And that's at the state level, right? So, there is a lot that can be done at the state level. There's things that can be done at the local level. You don't have to, go big or go to a Hill Day. You're more effective actually doing work directly in your community, going and seeing your representative while they're at home instead of when they're in DC. They see like 20 different organizations a day, 30, a day when we're in DC. And we hope that they will remember and they do take notes and all of that. But they are going to have, especially when they have more time with you as a constituent, that is when you're going to be the most powerful and effective. But like Kelly said, everybody's voice is important. And it doesn't matter if you're someone who's living with a disease or you're just a friend of someone. I mean, look at any other disease state and, none of us do it alone. So.
Yeah, we've been noticed. Sorry,
George.
You first. Ladies.
I was just going to say the theme of collectivity is running through this session and interview, and I'm thankful for that. I think it's going to take our collective voices, and I appreciate, Rebecca, you noting it starts at the local level, because I think George and I, through the show, are trying to mobilize folks, Kelly, through the stories that you noted. Folks, everyone has a story, and we're trying to motivate and mobilize these folks at the local level to share with their representatives their story, teach them a little bit more about Parkinson's, because that's what it's going to take to move the needle in a larger way if we all collectively share these very unique stories and educating the lawmakers on a disease they might not know a lot about. So, continuing with the theme in terms of collectivity, share with us how PMD Alliance works with other organizations to really amplify the voices of our Parkinson's community here in the U.S.
So that's really, we were built out of that idea that we are all better together, right? And so we love to collaborate and to partner. We try to put our money where our mouth is in that regard. We are, so the way that we would partner with other organizations, sometimes it's, what are we look at, what do we do well? What do you do well? Where are your strengths? And is there an alignment in the middle somewhere? Because we're all pointing in the same direction. And, we really believe that, and I'll say this out loud. I say it out loud sometimes, but we know that this community can be fractured. And I think we talk about it amongst ourselves. We don't always talk about it publicly, but it is, and it's true. And there's no blame or anything placed at anybody's feet. It just is the nature of being human, I think. And running a business and all of that. And, we're all pointing in the same direction, and we all exist for different reasons. And when people say, well, how come there's so many different organizations? Well, there's a lot of people with Parkinson's and probably people who are undiagnosed, and we're each trying to accomplish something different. And so for us, we like to be the gap fillers or the incubators, as I said, or the amplifiers. We recently just partnered with the PD Avengers to do the PD awareness campaign, because we were like, this isn't about our voice. This is about the voice of the community. And if the Avengers are the voice of the community, we should be lifting that up. And, love being able to do that across the board, and love being able, and if we actually work together, and I think if people see that, our win is a collective win. It's not just, well, I'll just use POP, for example, say it's not that POP won, so PMD Alliance didn't. No, like we both win because the community wins, and we celebrate each other's successes and the wins for the community, because we're doing different things, but we're just moving alongside together. And that's why, that's the only way we're going to, I think, truly make change versus, I think, overall hindering ourselves.
Yeah. Oh, go ahead, George.
I mean, I just hope through this show, everyone now, if they're not aware, knows somebody, a group called PMD Alliance, an organization that's not just powerful, but has the voices of people like all of us behind them. And also hope they'll go to the website, sign up, and just attend, events, whether virtual or live. And of course, support you, Kelly. My biggest thing, even with the show, and Margaret, we've talked many times, if we even reached just one person today that didn't know about PMD, and now they do, we've changed the world for the better for them. And I hope they'll also contact their representatives. We've been finding, as Margaret also mentioned, state is really the way to go. We don't usually plug shows. Hope Margaret doesn't mind, but we're excited that United States Congressman Paul Tonko will be joining us again. He's been on my show. What an incredible warrior of all of this movement and the national plan. But we've been getting the best responses from states. So I urge everyone again to call PMD, contact your representative statewide, and don't stop, because we need everybody 24/7, unfortunately, in this, until your family's out there, and Margaret's dad, and your of course family, Kelly, and also Rebecca. I'll never forget the people you've lost, and they live on through all of our work. But together, I just feel strongly that this is not going to end as long as it would if it wasn't for everyone coming together.
Thank you.
Well, as we move up, I never like to say end the show, because the show continues after the lights, paparazzi leave. The conversation continues, and I do feel these shows live on really forever. But what message can you both leave to Parkinson's community today with encouragement? And I guess if we can keep pushing, policy, because that's, we sometimes the show's so exciting. I want to talk about everything, but I always got to keep the P word going back to policy, and policy again.
I would just say, again, talking about that local level, that can start in community organizations, faith organizations, even like your hospital system. You can begin to find that you have a voice at those, even, outside of the state legislation. So just keep that in mind. Your voice can be heard anywhere to start sparking change. I don't think that coalition is optional. I think we have to come together. It's strategic. When I look at personally, what keeps me in all of these roles simultaneously really is the belief that each one makes the other better. And my father-in-law, and the honor and memory of your mom and Rebecca's grandmother and Margaret's dad, they deserve that, all of us working together.
Same. I was trying to come up with what I would say, but I think what Kelly said really hits the nail on the head. And I think, you don't have to know. I think a lot of us forget to start things or choose not to start things because we are afraid of what we don't know. But learning something new is good for our neuroplasticity. I've learned that. Kelly taught that. But also, we all start somewhere. None of us know what we're doing. And like we've said, your story, whether you're someone who's living with the disease or you love someone with the disease, whether they're a friend or not, often I notice people will diminish their experience because, well, it's not as, as hard as this other person's. But the reality is everybody's experience is important. And that, like you said, it is a collective voice, and we need people who share multiple experiences, because that is how we make progress and we make change.
Great. Want to send the show to wrap up to Margaret?
Yeah, I'm so thankful for you both, not only with sharing your time with us today through this policy advocacy effort that George and I decided to take a risk on, but it's been very positive. But for your work every day, steadfast work every day. I quickly shared a anecdotal story with Kelly offline that pretty early on my dad's diagnosis, PMD Alliance saw what we were doing through POP here in Central Virginia and wanted to highlight his story as we tried to turn lemons into lemonade and do our little part and move the needle and serve here in our local market. And then I'm so thankful that you guys are so collaborative, and we learned that very early on in our business in the Parkinson's disease space. So I'm thankful for that, and what you all, I can attest to everything that you've communicated in terms of your collaborative nature, you all working collectively with other organizations, truly for the patient and the caregivers. So I'm thankful for you guys, again, not only sharing your time with us, but for your steadfast work every day in this space. I know it's hard, but with folks like you, we all keep the hope and faith that we can make a difference and change the trajectory of the disease.
Well, and thank you for what you guys are doing. I mean, honestly, the folks who are doing stuff in their communities are the ones doing the hard work, really.
You guys are incredible advocates. Thank you.
So thank you for everything you guys do and lifting up all the different voices that you do lift up for the community.
Oh, it's hard to follow all these now. So I wanted to thank you again, Rebecca, Kelly. I can't wait to see you both again. I hope everyone listening will join us live at World Parkinson Congress. I'll be likely going live to somehow on Instagram with Margaret. We'll have to figure out and talking about policy, because actually this event doesn't really, address policy. That's one thing. It's interesting, but of course we're all there, so we'll be talking about it. They needed a whole table, I think. Also, we needed a show there for this. But anyway, I want to thank the entire PMD Alliance as well, organization, for being so supportive for POP and for Together for Sharon, and really again on some of the tougher days I've been having. I know there's a people behind the scenes always there for me, and that's why I don't give up. Whether my mother, all those two that we've lost due to Parkinson's, I feel their voices still matter, and so do their caregivers as well. So I wanted to, again, thank you all. Thank our beautiful and incredible, inspiring audience. Please share the show. Please go to PMD Alliance website. We'll share the link. And most importantly, the final drum roll, I want to thank Margaret and Adam, Power Over Parkinson's, for doing a lot of work behind the scenes, which we don't get to see. And sometimes we don't want to have to do, but it makes this show special. And again, I'm so excited for some of today's show, of course, and the ones that are coming up. So stay tuned, everyone. We love you. And this has been another episode of the Parkinson Policy Podcast, where we advocate together to raise awareness and advance meaningful policy for the Parkinson's community. We see you soon. Thanks, everyone.
Thank you.